My name is Charles Adams. This is Ambrosia Behavioral Health Podcast, where we cover topics on neuroscience, behavioral health, addiction, mental health, and behavioral health in general. Today, we have Dr. Allen, who has 25 years in neurosciences, with highlights in brain stimulation, neuromodulation. He is an internationally renowned psychiatrist, addictionologist, medical reviewer, and physician. He's been the principal investigator for 43 mental health medications on the market today, and he's a medical director for a behavioral health facility and founder of the Neuroscience Research Institute. Today we're going to talk about transcranial magnetic stimulation. And Doc, I've worked with you for a while now, and I know your story. I know a lot about you, and I know that this is something that you're passionate about. Would you mind talking a little bit about kind of TMS and what it is, where did it come from, what's the deal?
Yeah, thank you so much for having me on your podcast, Charles. I mean, it's always fun talking to you, and you're really well versed in some of the new approaches in neuroscience. So, the whole theory behind transcranial magnetic stimulation is basically stimulating the area of the brain directly connected with depression. Now, if you think about it, thinking that one can stimulate exactly the area of the brain, that's a fairly new concept in Western medicine. Until the early 1800s, we did not think that the brain was that relevant. In fact, we felt, the bloodletting and all of that, we felt that the four fluids were responsible for all, brain activity. So it was not until, later that we started to think that the brain actually had some functions. And then now we have such a better understanding of the frontal lobes, their function, the neural circuitry and things like that. So we've really learned a lot. And it was not until 1985 or so that we started to look at, transcranial magnetic stimulation. So essentially using a magnetic field to stimulate important areas of the brain.
Oh, is this like an evolution of ECT, electroconvulsive therapy?
That's a great question. So from a neuromodulation perspective and brain stimulation, yes, but, there are different technologies. I mean, TMS is non-invasive. You don't need anesthesia. Its safety profile is wonderful. And so, initially when the FDA was looking at it, they tended to compare it to ECT. In fact, the first study that we did in the late 90s was comparing TMS to ECT. And in fact, some of the FDA, applications looked at it comparing to ECT. It was not until 2008 that the FDA actually approved it as a treatment. And since then, there are about 16 or 17 devices that have been approved by the FDA for TMS. And the technology to stimulate the brain has really taken off in a lot of ways. And the success that we've had, not only looking at depression or treatment-resistant depression, as we sometimes call, severe relapsing or severe depression. We have good evidence, but there are other disorders that the FDA has since approved TMS for OCD. They've approved it for what they call anxious depression. They've approved it for smoking cessation. They're looking at some other disorder in Italy, for example. It's used for cocaine addiction. There are studies that have looked at alcohol use disorder. So it really has allowed clinicians another modality which is safe. Especially, there's a lot of skepticism about medications. It is very challenging for folks to accept psychiatric medication, and even when they do, there are limitations to medication, right? So if you look at trials like the STAR-D studies, etc., treatment-resistant depression is a very challenging disorder to treat. And then
what are the STAR-D studies? What is that exactly?
The STAR-D studies actually looked at, in a primary care setting, looked at the use of antidepressant medication. So they took approximately 7,000 patients, and then they looked at offered them one medication, and I think after the first round, just over 25% responded, and then they had a strategy of either switch or adjunctively add another medication, and they found that less than 20% improved after round 2, and then they did a round 3 and round 4. So they really, it was a great kind of a sample funded by the National Institute of Health, and generated a lot of important data about how difficult it is to treat depression itself. But there are medical disorders that are now like multiple sclerosis is one. I've been involved with a couple of seizure-related projects where
Alzheimer's too, right?
Yeah, so Alzheimer's and that, I think they're improving cognition is an area. So I think that I've been involved, as I mentioned, in TMS, since the late 90s. And recently we have been focusing on a device that was put out by the ExoMind team, because I really am focusing on wellness. So one of the advantages now, we know, for example, neuroplasticity, which is a result of transcranial magnetic stimulation. We know that neuroplasticity is what demonstrates, a realigning of neurons, so to speak, so that, we can improve mood and coping skills, and
sort of
effects,
new pathways in the brain, kind of thing.
Correct. Coping skills, if not coping skills, new ways of acceptance, working on your therapeutic modality, whether it's psychotherapy or whatever. Now, the effects on mood disorders are well known. I mean, there have been a number of studies that have looked at depression, and the FDA specifically approved TMS for individuals that have failed one trial of medication. And, we also did very early on a study looking at cognition, and as opposed to ACT that you brought up, the evidence supports cognitive enhancements with TMS. So you have a device, that's actually doing through neuroplasticity, doing the work of improving the mood. You have mood disorders, of course, they do improve. It's a cognitive enhancer, it improves focus. There's some evidence in benefit with ADHD. There are now folks that claim that it helps with their creativity. It also with memory enhancement, and as you mentioned in Alzheimer's, reducing cognitive decline.
I've seen the device, the ExoMind TMS device, and so essentially it's like an electromagnetic, an electromagnet, right? That targets specific parts of the brain. Is that how it works exactly?
Yeah. No, that's a good question. So What TMS basically is, it uses a magnetic field which is focused and applied. If it's applied on the left side, it's a dorsolateral prefrontal cortex where it's directly applied. So what you do is you use capacitors to create a magnetic field, which is about 0.5 Teslas, which is about a common MRI. That's the amount of energy that's focused on a small field on the area that is also known as the F3 area by EEG. And basically, this stimulation causes a polarization of the neurons in that area, improves the blood flow in that area. There's evidence of a lot of activity that occurs once that stimulation occurs. And what's interesting is there are a lot of studies that are looking at stimulating the right side of the brain at low frequency. So what's interesting is you do high frequency stimulation on the left that has an antidepressant effect, and then low frequency stimulation on the right. So there's a lot of effort looking at kind of a focus stimulation. Neuroimaging has also come in. It's an expensive way of locating the site to stimulate the brain, but there are some benefits. I mean, for example, there's a study that was done out of Stanford called the SAINT protocol that did something like almost 50 stimulations in a week. They were 3-minute stimulations in what is called theta burst stimulation approach. And,
on a single person, on an individual.
Yes. So they did multiple treatments during a day, just for a week, and found a very, very good response. Typically the treatments are daily treatments for about 30 to 40 days, and in this particular case, you're doing a number of treatments within a week. So folks that cannot, or that live in the rural areas, don't have access, it may be a way to do kind of an intensive 1-week approach to treatment with good benefit. The ExoMind device, for example, I mean, they've looked at binge eating, they've looked at motivation, they've looked at
general wellness, right?
General wellness, exactly. And the protocol that they use, because their device offers a little bit more than 0.5 Tesla of stimulation, they are able to use fewer stimulations as well. They don't have to do all of 36. But I think overall we have this modality that really is changing how we think about wellness, mood, attention span. I'm even told that Australia has done some studies looking at keeping pilots awake. Their Air Force and Navy pilots awake because of the long distances that they have to fly. So just, literally stimulating the brain is something these devices can do. And there are a number of, variations. I mean, I think the design of the coil has an impact. So for example, the FDA has approved. Now, there's also an approach looking at kind of a superficial or surface stimulation that goes down about 1/2 inch, and then you have deep brain stimulation that goes down, the stimulation goes down about 1.5 inches, sort of thing. So there are many different ways of looking at it. The design of the coil kind of creates, the exact area of stimulation. You can improve your precision, and then you add some, neuroimaging techniques.
I have some questions about that.
Sure, yeah.
So what exactly does it feel like? I mean, what does a patient experience, during a session? Like what? I mean, I guess they sit in a comfortable chair and they have this device that's kind of hovering above them, and what has been your experience with interacting with patients who have undergone the TMS therapy? Like what are they feeling? And I guess, is it an immediate result? Do they notice Do they notice it right away, or is it kind of a delayed response?
Great question. So let me start by first describing the experience. Actually, with the Examind device, the treatments are pretty comfortable. So we use a zero gravity chair and apply the coil after we locate the site of stimulation. We apply the coil directly over. It's sort of comfortably strapped in on the area that we're stimulating. The patient is in a meditative mode, if you may. And it lasts, depending on the protocol you're using, can last up to about 35 minutes or so. And most patients, just might feel a mild discomfort in the area. So it's hard to imagine, a magnetic field creating discomfort. And most of the discomfort is because of the frontal muscles being very sensitive, and so it causes contraction, a rapid contraction of the frontal muscles, and that may lead to a mild headache, which probably is the most common side effect. But in general, it's very well tolerated, and the clinician gradually we do what's called a motor threshold determination to actually measure the exact amount of stimulation that is needed for the appropriate effect based on individual differences. And then, at our site, we are also using EEG related brain mapping to look at the pre and post effects, and we're seeing improvements, in a number of areas. And so I think it's safe. There is no anesthesia. They're in a quiet, room with low stimulation, and the treatment goes pretty fast. And I think, one of the interesting things in all the years that I've done research is that most of these patients come back to finish their treatment. So unlike, medication compliance, for example, is considered the second biggest drug problem in the U.S. is patients, generally miss, a lot of medication doses. And how do you address that? So if you use sort of the same yardstick to look at, whether they show up for treatments, if they have to do them every day for 30 plus days, or if they have to see them, if they have to do them, at a lower schedule, if it's a theta burst approach, etc. I mean, patients do come back, and I think that's because of the experience. I think here you have an approach that helps you feel better, motivates you, it improves your attention span, etc. I think that I see it as being its use being expanded more and more over the coming years.
You mentioned brain mapping. I'm curious to know what sort of things are you looking for in the QEEG? What before and after? This is like an echo, like a echocardiogram, right, of your brain, kind of thing.
Yes, very much. That's well put. Yes, so the brain is a very electrical organ.
So what kind of things are you looking for exactly?
So we're looking for evidence of improved mood, improved attention. You can determine that through a quantitative EEG. So you can see the areas that had slow activity. You can improve that in areas where the brain. You need to see a balance of electrical activity in the brain, and you can see that the TMS helps in resetting the balance of that of what we're looking for.
Wow. Okay.
And so, we know that. I mean, TMS is fMRI studies have looked at TMS. There are a number of other imaging techniques have looked at the benefit of TMS. I think we're doing this just because the low cost approach to QEEG, as well as, patients want to see that they're getting better. One of the challenges in our field is to have biomarkers that tell you that, that things are getting better,
Is this, so has TMS, is it then like a replacement for medication, or is it a supplement to medication?
So currently the evidence is that it is, all of the protocols, most of the protocols have looked at it as an adjunct. So in addition to medication, where the individual has failed at least one trial of medications. So we know from the evidence that, once you start to fail one or two medications, then the mood disorder or depression that folks have is getting into the treatment-resistant arena. And so a combination of treatments do help. Now, do I recommend folks? Yes. I think those that are looking for wellness benefits, I think there is now evidence that, folks are benefiting, especially the work that the EvoMind team has put out. We can now see that there is evidence in improving attention, improving a sense of well-being. Patients have described that it's easier to get out of bed. It's easier to pay attention. Where we're seeing the ADHD benefits, for example.
Where would you see the split, like between, diagnosed treatment-resistant people who truly have some kind of a mental illness versus, I guess a mentally sound person who does not have a diagnosis, looking for general wellness? What kind of, in the volume of clientele that you've seen, where do you see?
I think that's a great question. So the folks that fall in the, needing help with a lack of progress that they've made on medications, that's a completely different subgroup, and we approach those differently, right? Because they require an assessment, a study of the failed medication trials, and match this treatment with the medications that they've been on. And of course, there are parameters that just within each treatment that you can adjust to give them, a larger dose, so to speak. Whereas the wellness approach is kind of standard stimulation, and the XOMind model, we do 2 stimulations a week, and so that has been found to be pretty beneficial. For example, in those that are experiencing a very stressful event in their lives, I think we had a neuroscientist that went through treatment who reported significant improvements in how she felt when she went back to work, etc. So, and then the last question you'd asked was, how many sessions before you see a benefit? Typically, in a 30 to 40 day model, it's about day 15 to 20 is when we start to see a signal, and others may see a benefit before before the patient themselves observes a benefit. And so, you have to be patient. It takes a few sessions before you start to see the difference that you feel, and one may be surprised as to how much better it makes you feel.
Wow.
And that would lead to a question of, then how long do you have to do it? Do you have to keep doing it?
Yeah, right. So, is it a permanent, are we permanently rewiring the brain?
So the evidence is that a course of treatment is probably good for about 6 to 9 months.
I see.
And in those that have depression, they switch over to maintenance medication and continue. I think it's a small group of folks that have to come back, to do another treatment, whether it's, you call it a booster treatment or follow-up treatment. In general, though, insurance covers allows for treatment, approximately 6 to 9 months later.
Wow.
You can do another round of treatment.
That's fantastic.
There's also discussion about how many treatments are enough. Should you overtreat? These are all questions that research is yet to answer. We may we have some answers from a consensus guideline type of approach, but this is, a number of experts getting together and saying, this is how we have to do it.
Yeah. And Ambrosia, it's a basic or neuroscience research institute. It's an individualized basis, right? You're looking at each person differently. You're not applying the same standard to each candidate, correct?
Absolutely. Yes. I think depression may even be a slightly different experience for different individuals, right? So I think to use, all of the modalities that we use, whether it's genetic testing, our assessments, neuropsychological testing, our lab work, all of those together with our neuromodulation techniques, and that's the area of interventional psychiatry is what patients receive.
I see. Well, that was pretty much all I had for you. Was there anything else that you wanted to add to the topic?
No, thank you so much, and I appreciate you inviting me to this.
Yeah, it's been a pleasure having you. Thank you, Doc.
Take care. Bye.
All right, bye-bye.